Okay. Hi, my name's Nick with Integrated Orthopedics.
Hi.
I'm here to go through your Recovery Plus machine for you for your knee surgery. Recovery Plus is just a iceless cold and compression system. It's going to help you with pain and swelling, helps with the soreness on the knee. It's also got some wraps that are going to squeeze on your calves, and that helps get some blood moving. So, after a big surgery, that helps reduce the chance of forming a blood clot.
Okay.
So I'll get the unit out of the case. This is the machine itself. The machine's called, again, the Recovery Plus. You'll have some buttons up front here that control everything. We're going to hook a remote to the unit as well, just to make it a little easier for you to use from the floor. The back's where everything else is going to hook into. That's going to be where we put our power cord. We'll have a hose connection that hooks up to your knee wrap. We've also got a couple wraps up here where it says calf left and calf right. That's where your calf wraps are going to go for the wraps that help with the blood clotting. So the first thing we do is we'll put the machine really kind of wherever you plan on being after surgery. That's typically going to be next to couch, chair, bed, wherever you find that you'll spend most of the time.
Okay.
When you plug the unit in, it's just a regular 3-prong plug that goes into the wall. The other side of the cord is just going to hook up back here at the back of the unit. And when it's plugged in, we should see the green light on. That's going to let us know that everything is connected to the wall properly. Your wraps, first what we'll do is we'll start by putting on your calf compression wraps. When you wear these, you'll always want to make sure that you put the calf wrap on first and then the knee wrap on second.
Okay.
So your calf wraps can be used on either leg, left and right, don't make a difference. Even though the back of your unit may say calf left, calf right, if you switch them around, it's still not going to make a difference. When we wrap your calf wrap up, we want to put the bladder of the wrap on the inside portion of each one of your calves.
Okay.
That's going to get the bladder right on the good spot of the calf, so it gets a maximum amount of compression. So you just Velcro your wraps up about as snug as you can. Usually I like to wrap it at the bottom first and then kind of work our way up. Just tends to make a nice snug fit. For you, you can also fold some of the wrap. If you find that these wraps are much larger, you can always leave a little of that folded first and then do the Velcroing second. You can see how that makes it a little easier to do.
Yep.
You can always trim some of that wrap too if you find that it's easier. Again, we'll plug these back here where it says calf left and calf right. And then we'll apply your knee wrap. So this is the wrap that's going to do our cold and our compression. And we'll Velcro that right over everything that you're wearing for the day. So you leave that over shorts, pants, pajamas, the dressing that you have. You just don't want to put the wrap on bare skin.
Okay.
Again, with these wraps, just like your calf wraps, you can Velcro them up as loose or as tight as you find comfortable. The wraps are self-adjusting, so if you wrap it up loose, it's going to put more air into it. If you put it on tight, it puts less air into it. So pressure is going to be the same no matter how you have them on. Your connection hose then that hooks the machine and the wrap together are different on each side. So our sides that are going to hook in to the wrap can't fit into the machine. Same way on that end. You have two greenish bluish connections. Those are your water lines. Your air connection, which is the odd one out, that's your clear connection. And so you just plug them in until you hear a click. Same way with our water lines. And our water lines are interchangeable, so they can go either way. It's not going to make a difference.
Okay.
Back here on the back, I can get the cords out of your way. Back here in the back, you'll got your other side of the connection. Again, one air connection, two water lines. And then lastly, all the lines kind of facing away from you. And we'll hook up your remote. So your remote has all the same buttons that the front of the unit has. There's a little red line on there. There's one on the front of the machine. So we just want to line those two together before plugging it in. Now everything that the machine does is all preset and programmed the way that your doctor likes it. So to turn it on, you just hold the circle with the line in it down until you see the screen light up. Once the screen lights up, we'll let that button go. And then after it initializes, it'll tell you to press the up arrow to start. Once you do that, all your cold and your compressions are pre-programmed to start up. So you've got your cold, your compression, and then your calf compressions are going on each leg. Now those calf compressions will alternate back and forth, so you shouldn't feel them squeezing both at the same time. Your cooling is set up at 45 degrees. You can hit the up and the down arrow to change that. You just can't go lower than 43. You can't go over 55.
Okay.
When you're ready to get up, say for like a restroom break, you can tap the power button that pauses the machine. So we'll undo the wraps, you go do your restroom trip. When you come back, you just Velcro them back up just like we have them, and then you press the up arrow to start again. I know if we're done for the day, done for a few hours, maybe headed to therapy, you can always hold the button, that'll turn the machine back off. Once you turn it back on, now we're just repeating the process.
Okay.
If you do leave the machine running continuously, the cooling on your knee wrap is programmed to do 2 hours on with a half an hour off. Once the half an hour is done, the cooling will start back up. So should you need it at night or fall asleep with it on, that coil will keep cycling on and off like your doctor likes as a maximum.
Okay.
And so that's our machine. The unit itself is already filled with water. Shouldn't have to add water into it. The machine is just going to recirculate the same water. So as long as we're not losing it, we shouldn't have to fill it back up.
Mm-hmm.
But your bag does have a whole bottle, which would fill the machine back up if you needed it. Your doctor ordered the machine for the next 21 days. And so when the 21 days is up, we'll come and pick the unit back up from you out here at the house. If you're done before the 21 days, just give us a call and we can come pick it up early as well.
All right.
Questions?
No questions, but
Yeah.
can I start?
Yeah. The machine, if you do get questions as you are using the machine, or should you have a malfunction, it stops working on you, give us a call. The number is on your machine. It's also going to be on your patient handout, which reviews the doctor's protocol that we went over. But anytime if you're having an issue, late, weekend, holiday, you can always call the highlighted number here, which is our main office's number. And an after hours representative's number will be on there for any questions when the office isn't open. Obviously you've got my cell phone number down there at the bottom. You can call, you can text me too if that's easier for you. Just know that I may not be as available after hours if something comes up when we're closed.
Sure. All right, everything makes sense.